What is respiratory syncytial virus, RSV? Infections of the lungs and respiratory tract are caused by the respiratory syncytial virus, otherwise known as RSV. It's so widespread that most toddlers are infected by the time they reach the age of 2. Adults can also be infected with respiratory syncytial virus. RSV symptoms are minor in adults and older, healthy children, and they often resemble the common cold. Self-care is frequently all that is required to alleviate any discomfort. Some persons, such as newborns aged 12 months and younger, the elderly, or anyone who is immunocompromised, are more susceptible to RSV infection. Signs and symptoms of RSV. The signs and symptoms of RSV usually develop 4 to 6 days after you have been exposed to the virus. RSV normally causes mild cold-like symptoms in adults and older children. Symptoms can include congested or runny nose, dry cough, low-grade fever, sore throat, sneezing, and headache. RSV infection can extend to the lower respiratory tract, producing pneumonia or bronchiolitis. RSV has the greatest impact on infants. The majority of children and adults recover in 1 to 2 weeks, while some may have continued wheezing. Causes of RSV. Through the eyes, nose, or mouth, the respiratory syncytial virus enters the body. It can spread easily and rapidly by air. If someone with RSV coughs or sneezes near you, you may become infected. Direct contact, such as shaking hands, can potentially spread the infection to others. On hard surfaces such as countertops and toys, the virus can survive for hours. You're more likely to catch the virus if you touch your mouth, nose, or eyes after handling a contaminated object. During the first week following infection, RSV is at its most contagious. Prevention of RSV. Respiratory syncytial virus currently has no vaccination available. The following best practices can aid in the prevention of the infection spread. Hands should be washed often. Always make sure when you cough or sneeze that you cover your mouth and nose. Make especially sure that countertops, doorknobs, and handles in the kitchen and bathroom are clean. Drinking cups and utensils should not be shared, especially when someone is ill. Please don't smoke. Babies and the elderly who are exposed to cigarette smoke are more likely to get RSV and experience more severe symptoms. Wash toys on a regular basis, particularly when your child is sick. Be sure to like, subscribe, and hit the notification bell to get more videos like this one.